And we are live, doctor.
Hey guys, it's Dr. Emer. I want you to take a look at our patient yesterday. I know so many people have written to us about him, asking if he needed a tummy tuck, asking if he had lost a lot of weight. This is a client of mine that came in that just wanted to have more athleticism. He did have some looseness here, you could see in the chest and the stomach, and we talked about the need of doing skin removal and lifting as well as lipo to get a better result. Here we are today at day 1. Without doing the tummy tuck, you could take a look at his stomach. Squeeze for us a second so you could see some of the muscularity is actually already coming in. We flattened, look at that stomach here in the lower part. We flattened all this. Now I do want to tell you guys, this kind of roll under here, we call this kind of the W look. This area here tends to be very difficult to flatten, but remember we did really aggressive Renuvion to try and get it to tighten. That's the internal radiofrequency heating. All through here and all on the sides. Even look at the sides here. He didn't have a lot of fat here. You see the stretch marks, but we're able to really get that to tighten up. And the cool thing is you could see the redness actually in those stretch marks. That means the Renuvion really activated the dermis to start tightening and produce collagen. Will you rub between his abs here for a second just so we can show them. Look at the sculpting, you guys. He didn't have that before, and look what's gonna come out in the next few weeks. And make sure you guys let me know if there's anything that they're saying. Look at his stomach here. You're going to really be able to see all the contouring. We went around his natural ab shape because I don't like to leave a fake look. And we also were really aggressive with the lipo on the stomach to be able to get him to be flatter and as tight as possible. If we needed to, one of the things we talked about was going back and doing a mini tuck if needed, but I actually think he's going to tighten up a lot. We're going to be really aggressive with the compression afterwards, and he's going to do our aftercare. The other thing is his chest, you guys. Look at the chest. So here's his before, angled downward. You can see that here. Now take a look. We have a straight angle and much more athleticism at the top because we did fat grafting. So show them a little bit. I'll cover you up. Show them a little bit of the chest here. Look at the border here. Come around the side. I want you to show the side really quickly. So keep the head down, keep your head up, don't show his head. There you go, but show them here, so I'll block him. Show, again, the chest. Come down a little bit and straight 90 degrees. Come up a little bit so you can show the roundness. Look at the roundness in the chest, you guys. That's the fat grafting, that's the lifting. Before, you could see, I'll bring it over here, really, really loose. Come back down so we don't show his face. Now, much tighter, much more angled. We did our lifting here, we did our gland removal here, and he's gonna look better, much better. So he's gonna have more of an athletic shape. So again, come up to the top so we can just show his full body without his face. Perfect, and kind of come over 90 degrees, like go this way. So it's right on top, perfect, yep, there you go. So now you really could see his body. So here's the before, here's the after. Look at that lighting and shadowing, really showing his abs, and really showing how flat he's going to be on the lower stomach. How much pain is it?
Not bad.
Not too bad. Although lymphatic massage is painful, the Renuvion really helps internally tighten everything. Our goal is to get stuff out here, and then I'm also going to have a massage into the armpit because it's very important to push all the fluids into the lymphatic area. So that's day 1. What are they saying on there?
One of your viewers would like to know, what is the approximate cost for this procedure? They know it's different for every person, but want an approximate cost.
Well, we talk about this all the time, you guys. You have to consult us. DM your name, email, and phone. This is a full body, so full areas can be $20,000, $30,000, $40,000, depending on how long we're in surgery. This is a big surgery. Small areas and different doctors in my practices could range between $5,000 and $10,000 per area. So it just depends. We did a lifting, we did grafting, we did full body, a lot of extensive heating. With Renuvion, I did about 12 quadrants of heating, so it takes, like, that alone takes over 2.5 hours. So it's a very time-consuming, more expensive surgery, but the results are life-changing. Look at the lateral contours here. Look at his abs. You can actually see them popping out even at day 1. We call this the GLADIATOR sort of body contouring procedure. I'm really excited for him. What else are they saying?
One of our viewers like to know, what is this? What are they watching right now?
This is HD-lipo, you guys. Body transformations. You've come to Jason Emer MD. That's what we do. So
we have Sign Me Up. Dr. Emer does it again. A true body sculpture.
It's all about artistry, you guys.
Amazing.
We're super excited. This
Yes,
is great.
my chest needs the same thing.
Come and see
Thumbs
us.
up. Good work, Dr. Emer.
You know, so many guys struggle actually with this sort of looseness in the chest area with glands. We posted his glands actually on stories showing how big they were. Those are rubbery glands inside that literally cannot be removed without surgery. And so now it's just going to be at a whole new level. We're going to get him on hormonal and peptide therapy. So we do that for aftercare. IV therapy. If he does peptides, it will tighten his skin even more. There's a lot we can do. And then we're also going to do hyperbaric therapy so that he heals faster.
Dr. Emer, do you have to be at your ideal body weight before this procedure?
The more ideal you are, the better the sculpting. The less ideal, it might be a staged procedure. So that's it. That's day 1. Thanks, guys. Keep following along. Perfect. So just end. Hold on.